Good afternoon, RGEA members and guests. Welcome to today's webinar, Caregiving Journey, Innovative Resources and Support for North Carolina Caregivers, presented by Lindsay Golden of the Alzheimer's Association and Neil Shaw, CEO and co-founder of CareYaya. I am your host today, Daryl Davis Bowman. Our primary presenters are Lindsay Golden and Neil Shaw. Lindsay is the Director of State Affairs with the Alzheimer's Association North Carolina and leads all policy efforts at the state level. Lindsay is working to expand support for dementia caregivers during the 2025 long session of the North Carolina General Assembly by increasing funding for Project CARE, North Carolina's only dementia-specific respite care program. With more than 373,000 dementia caregivers in our state, ensuring adequate support and access to resources is a top priority for Lindsay and the Alzheimer's Association. Neil Shaw, CEO and co-founder of CareYaya Health Technologies, is a former hedge fund manager turned social entrepreneur after deeply personal experiences with caregiving. CareYaya is a tech startup and applied research lab focused on enhancing caregiving. Its flagship product is a technology platform that lets people quickly book experienced caregivers that are uniquely all students in the healthcare field, helping expand the care workforce amidst a critical caregiver shortage. And many of you heard about caregiving following the death of Gene Hackman and the importance of taking care of the caregiver as well, something Lindsay will talk about, as well as Neil. Yes, as well as Neil. In addition, CareYaya is launching a new application of artificial intelligence, AI, to help people better manage caregiving, aging, and serious illness. Its mission is to empower family caregivers and create a better future for care. Both presenters will discuss caregiving today and will offer some resources for you to access and explore for your caregiving needs now and in the future. Before we begin the webinar, I want to go over a few items. Each of you has been muted to help ensure the presenters can be heard. The presentation is being recorded, and we will send you a link of this recording along with the PowerPoint following this presentation. For those of you who sent questions, we submitted them to both Neil and to Lindsay. Many of these questions will be incorporated into their discussion today. And if you think of any questions during the presentation, please use the Q&A button at the bottom of the Zoom page. Questions will be answered during the Q&A, if not before. So without further ado, I'd like to introduce you to Lindsay first, Neil second, and we really, really do appreciate you both being here today. So take it away, Lindsay.
Thank you so much, Daryl, and thank you to everyone for joining us today. As Daryl said, I am Lindsay Golden, the Director of State Affairs with the Alzheimer's Association. I've been at the association for just over 4.5 years, and a lot of the work that I do is working with caregivers. So we have a robust advocacy program that pulls in advocates from across the state to talk with legislators on our policy issues, which almost always includes a caregiving component. So I have heard so many stories of what caregivers have gone through on their dementia journey, but then caregivers for other issues as well. So we hope this information will be helpful. And as Daryl said, we're always available now and after this presentation if you have any questions. So at the Alzheimer's Association, our overarching vision is a world without Alzheimer's and other dementia. If you have experienced an Alzheimer's or other dementia diagnosis in your family, you know how difficult it is. It is completely life-changing, and especially from the caregiving perspective. So at the association, we'll talk through a lot of different resources that we have as an organization focused on supporting caregivers, because a lot of caregivers are working full-time. They have children and they're also caring for a loved one that needs extra support. That's a really, really challenging journey. So we want to make sure that people have the resources they need to make it a little bit easier. So the overarching way we do this is leading the way to end Alzheimer's and all other dementia. And this trickles down to a couple buckets: accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. So right now in the US, the number of Americans over 65 living with Alzheimer's is expected to nearly double by 2050. So right now we're at about 7.5 million people living with the disease, and that is rapidly increasing. So the number of caregivers is also going to continue to rise. So these are some North Carolina specific numbers. So in North Carolina, we have over 180,000 people living with Alzheimer's. And then when it trickles down to caregiving, we have over 350,000 caregivers. That's a lot of people in our communities. The value of this unpaid care is over $7 billion. And again, that's just in North Carolina. So when we are thinking, caregivers are putting this much effort into caregiving, what maybe are they not able to put into other areas of their lives? We also know that the hours that these caregivers put in is over 500 million hours, again, in our state. So I think this really sets the stage for there are a lot of people going through the same situation you may be going through. We have some people that have been caregivers for years and some people that are very new to their journey. And on the spectrum, we have support resources for everyone. So when it comes to caregiving and caregiving for dementia, caregivers face a special set of circumstances. Caring for someone with Alzheimer's or other dementia often involves a unit of people. So it is very, very difficult to have one person navigate all of that because it includes daily caregiving, decisions, carrying, taking someone to a doctor's, all of the things. There are just so many pieces that go through it. And dementia makes it complicated because there's different stages of dementia. You can have mild cognitive impairment, early stage Alzheimer's, moderate, and then late stage dementia. And caregiving looks very different in each of those stages. So I think a lot of people aren't generally aware of that. So I want to kind of talk through what are the different stages of caregivers? What are the challenges that you may experience and the resources that may help you along those different periods? So stages also come with different behaviors, both behaviors of the person living with dementia, but then the caregivers as well, because again, the needs change. So in early stage caregiving, and you will receive a PowerPoint with all of this information afterwards, all of this blue information is hyperlinked. So it'll take you to specific resources to give you all of the information to support all of these stages. And hopefully that'll be a valuable resource. So early stage caregiving is when the symptoms are more mild, and the main caregiver aspect is support. So figuring out how the person wants to navigate their dementia diagnosis, which doctors to go to, being there to listen, that type of thing. Middle stage caregiving is that kind of big band of what most people experience at the middle stages of dementia. You will start to see increasing needs of care. So maybe your loved one is no longer able to drive and you now have to take them places. Maybe they're no longer able to manage their finances because it has become too much. So then you have to, as a caregiver, step in and navigate that. The middle stage of caregiving is where people start to really feel the burdens of their caregiving journey and really often start to seek support, whether it's through the state, other organizations like the area agencies on aging or senior centers, or organizations like the Alzheimer's Association. Late stage caregiving is very, very difficult. This is when your loved one with dementia is often in the very latest stages where they require intensive care. So think of maybe they have now transitioned from assisted living to maybe needing memory care in a locked, skilled unit. Maybe they have lost their ability to verbalize anything. Swallowing has become an issue. So eating and getting nutrition is now a challenge at this stage. And as a caregiver, this stage is incredibly challenging because you're focusing on making sure they have what they need by also dealing with your own grief and what they're going through. When my family went through this situation, the late stages were brutal because to some degree, you're grieving the person while they're still here. And then when they pass, you're grieving them a second time. So again, that stage is really, really, really challenging, but there are so many resources to support folks in that situation. So looking at the impact of caregivers, There are a lot of different aspects that I think caregivers may not always experience. Certainly, when I was in this role and supporting my husband's family and caring for their loved one with dementia, there were a lot of things that I didn't even think about. But caring for someone with Alzheimer's or other dementia can put a physical, emotional, social, and financial toll on family caregivers. The financial burden, and I saw a lot of questions that folks put in the chat beforehand, the financial toll of caregiving is immense. In our state, on average, caregivers spend about $12,000 a year of their own money to care for their loved one. That's really tough when you are managing all of the different things. When you're looking at the lifetime cost of caring for someone with dementia, 70%, the number is a little bit higher now, is borne by the family caregivers themselves. This can be out-of-pocket expenses, unpaid caregiving, or if you are looking to have someone in a memory care unit, the average memory care room in North Carolina is between $10,000 and $15,000 a month. Most people cannot afford that. But whatever you are in that situation, maybe it's assisted living or a middle road situation, it's still really expensive, and the caregivers bore the weight of that. And we have a lot of new information that we are finding out about the emotional toll and what it does to caregivers. So, just under 60% of family caregivers rated the emotional stress of caregiving as high or very high. Every single caregiver I know falls into that category. And a lot of times it's unfortunately in the very high bucket. It is just immense. So, with that, we're going to start talking about some resources that you can tap into. With caregiving, with managing dementia, nothing is going to work for every single person. What may work for one person may not work for someone in rural North Carolina, because maybe in Charlotte or the Raleigh-Durham area, there's a lot more options. So, there are ways to tailor it to what your family situation is. So when you're looking at in-home care, and again, all of these have links that you can click on later on and learn more information and resources specifically for each of these topics. But you can have in-home care where you're having caregivers physically come to your home to have those conversations. Generally, this happens in the early or the late stages when you've brought them back home. Planning ahead for legal matters, this is incredibly important. We are hearing more and more about care planning and the importance of that. But when someone gets a diagnosis for dementia, it is critical that that person and their family members start to have conversations. What do they want the end of their life to look like? A lot of people don't love the idea of being hooked up to tubes and life-saving measures. So those are important conversations to have so the burden later does not fall onto those caregivers. So if you're in that situation right now where you have a loved one that maybe has had a diagnosis of dementia or another disease, have those conversations with your family. They are challenging, but it is so important in giving you the power and autonomy later on. When you're having these care planning conversations, it's also really important to talk about care costs. If you're on Medicaid in North Carolina, that will help with a lot of the cost. But we have a majority of folks that fall into that bucket of they make too much to qualify for Medicaid, but they don't make enough to pay for the care. So planning for that is really important for the families. And that's where we really encourage the entire family to be a part of that conversation. So you don't just have one main person that's bearing the burden of that, but later on, we often see that can cause challenges between the family members. So certainly talking about care of costs. And then also thinking of, you want to think about in-home care options, but thinking about long-term care options. So looking at the different skill levels, assisted living, memory care, that type of thing. Very important to do on the earlier end. So these are something that we encourage people kind of in that first stage of caregiving, the early stage bucket of your caregiving journey, to have these conversations. And if you are in the mid to late stages and you're realizing, I have not had these, oh no, it's too late. It's not too late. It's better to have them at any point than to not have them at all. So I talked about at the beginning about how we as an organization are really focused on giving caregiver support. So these are things that we have in North Carolina specifically to support caregivers from across our state. At the association, we cover all 100 counties. We will provide support in all of those areas. So we have three main offices, but we have staff that cover across the state, and every county is cared for. So we offer free education programs and dementia care resources. This is kind of done in a hybrid way. We have online only support resources, we have in person, and we have hybrid programs. This is all to prepare caregivers and families going through difficult situations with the information you need. Knowledge is power, and we want to get it to as many people as possible. This can be anything on programs of knowing the 10 early warning signs of dementia. We can come do these at church groups, senior centers, anyone. So if you have anyone that you think might like to have an educational program, please let us know. We would be happy to bring that to you again, free of charge. And it's really, really good, helpful information. We also have a big focus on caregiver health. So, managing stress, how to take care of yourself physically and emotionally. So, we have specific programs and information on learning how to manage that stress. Again, these are both in person and online resources. So, these links will get you what you need for that. But I think one of the things that our caregivers have found incredibly helpful on their difficult journey is support groups. We have support groups that take place across the state. Most of them are in person, but we do have some online options because for caregiving, you can't always just leave the person you're caring for and go to an in-person event. And we are really cognizant and aware of that. So we have support groups that are people going through this similar issue to you that understand it, that are sympathetic and there to support you. And when you can talk about your stress or your situation, what you're going through, it helps to relieve the burden a little bit. So we do really encourage you to look into these support groups. So we had a lot of questions on respite care and resources people can tap into. So I did want to touch on these two items. So we have Project Care. So this is what Daryl mentioned that we are working on right now as one of our policy priorities. And Project Care is a dementia-specific respite grant program run by the state. So this is a program that started really being funded in 2016 to allow dementia caregivers up to three $500 vouchers a year, along with some caregiving support on their journey. So this respite care can help offset the cost that caregivers experience. So bringing someone else in the home so they can have a break, go to their appointments, give themselves some time back. This funding has since sat stagnant since 2016. So we are working on this legislatively right now to hopefully increase the funding. But this is an option, and we highly encourage you, if you are a dementia caregiver, to tap into this. But we also know that not every person is a dementia caregiver. You may be a caregiver for someone else, maybe someone with a disability. We do have a program in North Carolina called the Community Alternatives Program for Disabled Adults. You will hear it most always as CAPTA. That program will pay caregivers to take care of their loved one. It's through NC Medicaid. So this click here to learn more link will have all of the information you need to know. It is a great program. We have a lot of people that tap into that. So those are just two options. There are others. Some senior centers across the state may have respite grants that they can give. Some area agencies on aging have some help as well. But that's at a very local level. So you can certainly look into those, but these are the two biggest. And this is our main landing page where we have all of our caregiver support information. So I encourage you to write this link down, or if it's too much, you can always just do alz.org. Then you can find the caregiving tab. It is one of our main tabs on the site. This will get you all of the information you need to get the support. Our website has not only resources as in English, we also have Spanish resources, which I think is really helpful. There are also some resources in Chinese, although I know we don't have a lot of folks in North Carolina that fall into that bucket. But this site is a tool and a resource we encourage everyone to use. Before I worked at the association, I had looked at these resources to help our family going through a situation. And quite frankly, we did not know how to manage it. And it is very, very overwhelming. So we encourage you to look on here and help manage the situation as best you can. So additionally, we have a 24/7 helpline, and the number is 800-272-3900. It's in that first bucket on the screen. We have free help across the country. It doesn't matter, maybe if you live in North Carolina, but you're caring for someone that's in another state, that happens a lot. You can call the helpline and get free advice, specialist. And what's great about our helpline is it is staffed by master's levels clinicians. So it is people who understand what you're calling for. You're not going to get pushed to customer service line with people who cannot help you. You will have help when you need it. And a lot of time for caregivers, it doesn't come at inconvenient or at convenient times. We have a huge uptick of calls around the holidays. Holidays are incredibly stressful for caregivers, so use this as a resource. As I mentioned, we have free education. But then we also, the last one is a really cool resource. So quite a few questions as well, touched on what are different programs, services, how do I find stuff that's even available for me as a caregiver? So the Alzheimer's Association partnered with AARP on a community resource finder. So the link for that is communityresourcefinder.org, and you can type in your zip code and it will pull up a plethora of resources for you. Senior centers, physicians, adult day programs, all kinds of things to help you on your journey. And that wraps up what I have for you today. So if you have any specific questions, my email is at the top of the screen. Please feel free to reach out. If it's not something that I can directly help you with, I am happy to connect with one of my association colleagues who works in the area. So whether it's today or in the future, we are always here to help with any questions you may have.
Lindsay, thank you so much. And Tracy put the website in the chat as well as the phone number. And I just want to remind folks we will be sending the PowerPoint so you can see it there as well. And Lindsay, I saw a couple of questions in the Q&A. Do you see those? I don't
I
know if you,
cannot see the Q&A right now with the screen shared.
okay. One is there a relationship between fatty liver disease and dementia?
I do not know specifically, but there are a lot of other diseases that can increase your chance of having Alzheimer's. So we generally say what's good for your heart health is good for your brain health. So it's bad for your heart and lungs, bad for your brain. So smoking, diabetes, hypertension, cardiovascular issues are all increase your chance for having dementia, but there is no one sure thing that will, indicate whether or not you'll have dementia.
Okay, great. Thank you for that. And Wendy has asked, are there any suggestions regarding dealing urges from the patient to go out, say to the store several times a day? Is there any harm in multiple outings a day?
Wendy, great question. And I'm sorry that, that question normally is coming from somewhere and that's probably your experience and what you're going through. That can be really difficult to navigate. There are resources on our caregiving page that kind of walks through some of those items, how to have difficult conversations with someone living with dementia. Because when they have dementia, talking to them may look different than when they did not have dementia. Driving also comes as a big component with that. So would encourage you to look there, but I think it's what works best for you and your family. So some people kind of indulge the person living with dementia because it's easier for all involved. But then some families realize they have to set those boundaries, even if it's difficult. So it's whatever works best for you guys.
Okay, I have two more. One, are there resources or care facilities for 56-year-olds who have alcohol drug related Alzheimer's?
So we have a lot more people being diagnosed in their 40s and 50s. Alzheimer's traditionally, and most of our statistics are 65 years and older. But we do have a lot of people being diagnosed early. So yes, there are facilities that will take you when you're younger if the families are able to pay. I don't know any facilities specifically focused from drug and alcohol induced dementia. But yes, we do have folks, unfortunately, that go in at a much earlier age than you would traditionally think. And adult day programs may be a nice gap. So we have a program called PACE in North Carolina, that it is a great adult day program focused on engaging people in an outdoor setting to give caregivers a break. That might be a resource you could tap into.
Okay, great. Another question, does a patient have to be eligible for Medicaid to get the services from the Community Alternatives Program?
Yes.
Okay. Okay, I thought that might be the case, but they could go to that link and learn more. I
Yes.
think you
So
put
that
out
link
there
will
on.
walk you through kind of what are the qualifications to fall under that. And then there's actually an application process linked on that page as well.
Okay, I'll do one more and then we'll save the rest for the Q&A at the end. But while support providing financial, wait a minute, uh, while providing financial assistance to caregivers, what safeguards are in place to prevent elder abuse or fraudulent use of funds, such as receiving funds but neglecting or not providing the care? I guess the
So
question is around fraudulent.
CAPTA
Hmm.
has some requirements within the program and some guardrails to help try to circumvent that. But I think that's a larger question of elder abuse in general. The dementia population is extremely vulnerable. So in North Carolina, adult protective service workers and guardians often have to get involved in these situations where funds are being misused. But oftentimes, unfortunately, they're not identified until it's too late and things have already happened. So if you're in that situation, feel free to reach out and we're happy to connect you guys with resources to help.
Okay, great. Lindsay, you could look at the Q&A at the bottom of your screen, and I think there are two more questions there that perhaps you might be able to answer while we are listening to Neil.
Perfect.
So thank you, Lindsay. Excellent. Neil, your turn. And don't forget to unmute.
Oh, thanks,
Okay, go
Daryl.
ahead.
Can you hear me?
Yes,
Okay,
gotcha.
great. And can
Thank
you
you.
see the screen?
Yes.
Okay, great. All right. Hey, everyone. Thanks so much for taking the time. I'm Neil Shah, the CEO of CareYaya Health Technologies, and I'm here to talk about innovations we're doing to improve elder care in North Carolina. I actually started CareYaya 3 years ago after a personal journey through caregiving for my grandfather through dementia and for my wife through cancer, both of which led me to leave behind my prior career in my mid-30s, because I thought this was like a huge thing that was impacting a lot of people. I became a full-time caregiver for a couple of years, and after that, I started this. So, going to kick it off with, like every time I clap, somebody's getting dementia right now. And in the next few years, it's going to go like this. Like, I think that there is a huge crisis coming in society, and that is going to be skyrocketing rates of dementia. And I'm going to talk about kind of like why this impacts everyone. I think there's a dementia care crisis. I think we're entering the crisis with a completely broken care industry. There's going to be a disproportionately large impact on women and minority populations. And I'm going to talk about our solution that we're building at CareYaya, but I really inspire other people to build solutions as well. So I'll quickly go through some of this crisis stuff. And you guys can access the report later, but I think it's really three main reasons: the aging population, social isolation over the last few years that people have faced, and the brain impact from COVID-related infections. Everybody knows dementia probability increases with age. And sorry, I'll go through this a little fast in the interest of time. But if you're lucky enough to live to 80, you're going to have about a 33% chance of getting dementia. So if you think about when the baby boom started after World War II, we're just hitting that era in society where most of them are going to start turning 75 to 80 years old over the next few years. And I think we're going to have skyrocketing incidence of dementia. Unfortunately, also increases with loneliness and isolation. And what do we have? Last few years we just went through a pandemic where people became greatly isolated. You have triple the odds of getting dementia if you're isolated for a few years. And then final thing is even mild COVID infections in older are showing a pattern of inflammation very similar to early stages of Alzheimer's. So I think just even a minor COVID is going to have a skyrocketing impact of dementia on the older population. So I think crisis always presents like kind of danger and opportunity. I think the danger is demand for care is going to rise a lot across society. I think we're heading into the situation with huge workforce shortages across healthcare and home-based care. And I think that's going to lead to a lot of disparities in access and worse outcomes. And then I think the opportunity is, people can innovate and figure out ways to bring more people into the home and healthcare industry. I think we can use technology innovation, to both lower cost, expand access, and improve outcomes. And I'll skip over some of this crisis stuff quickly, but basically there's about 800,000 people in our state that need help, and only 150,000 can currently afford care options. So the care industry is really out of reach for most people. Population is aging fast. I think the care needs are going to skyrocket. The 80-plus-year-old population is going to double in the next 10 years. To combat this coming crisis in care needs, we're going to need a huge army of caregivers. And what are we actually facing? there's 100,000 care workforce right now, almost 200,000 additional are needed, and people are actually dropping out of the workforce. North Carolina ranks nationwide at having less than half of the per capita caregivers as the country average. So we're already in a bad situation compared to other states like New York. And I think it's really because the care agency system is broken. These home care agencies are charging, on average $30+ an hour, making people sign contracts, et cetera, and then turning around and paying less than half of that to the care worker. So most care workers in North Carolina, I think on average get paid $11.50 or $12 an hour. So it's a vicious cycle that leads to people burning out and then families not being able to afford care. Median cost of home care is skyrocketing. I think right now, if you need 40 hours a week of care, you're looking at $60,000 a year. So, I mean, no middle-class family can really afford that right now. It's optimized only for the rich. And then everybody's complaining about caregiver shortages, but you look at the job market, tons of people are looking for a job, and I think no one's approaching these care agencies for jobs because they don't pay well. And I think that's a critical question. So then what are you going to do if you need to care for someone? Put them in assisted living. I think Lindsay just mentioned, median cost of assisted living now is pushing over $60,000 a year. I think that number was like a year old. And then 90% of the facilities are understaffed too. So I don't think that's a great outcome either. So I think, unfortunately, this is going to be the issue. It's going to fall on the family caregiver. And I think what a lot of people don't understand about society is that after the baby boom, there was a baby bust. So there are just simply not that many people in society that are middle-aged that are going to take care of all this aging population. The ratio of middle-aged people to older people in society went from 7-to-1 for decades. To this decade, it falls to 3-to-1. So I think that's going to be a big challenge. Everyone knows the impact from lack of in-home care, as I think Daryl alluded to, Gene Hackman, you're literally going to have a burden on family, worse outcomes, loneliness, depression, higher risk of falls, really impacts the family caregivers. 1 in 4 family caregivers report a physical health toll within 1 year of becoming a caregiver. I've experienced that myself. And I think it disproportionately affects women. I think there's a lot of people stuck in the sandwich generation right now that are going to have to take care of their aging parents while they're raising a family, taking care of their kids, and trying to manage their own job and career. 1 in 3 people quit a job in their career due to caregiving. And interestingly enough, it's not for childcare like most people think. Almost 60% of people are quitting because of elder care or spouse serious illness care. And I think the number one reason they cite is unaffordable costs. I also think it's a systemic financial discrimination. A lot of minority families can't afford traditional care industry, and they'll drop out of the workforce to provide the care themselves, which means they'll take a hit to their own career and their own earnings power. So I really think we're at a crisis point, and we really need to do something to build affordable care support to support both the person needing the care and really their family members. So this is what we built at CareYaya.org. We built a technology innovation to bring a lot more people into home and healthcare, lower cost, and use tech to improve outcomes. And the word Yaya has multiple meanings, including grandmother in Greek, caregiver in Swahili and Thai, and really you are your advocate. We believe it stands for future of self-directed care. Here's our team, hodgepodge across technology, business, and public health. A great group of advisors across kind of Blue Cross Blue Shield health insurance plans, telehealth companies, et cetera. And really, here's the opportunity we saw. There's 75,000 college students across our state that are going into some sort of healthcare career who currently do not participate in the care economy. Many of them are doing things like Uber or DoorDash to make side income, but they really want to care for people because that's kind of what they want to go into in graduate education and future clinical careers. They really want to make an impact. So we built a tech-enabled caregiver registry for them, similar like an Uber or DoorDash-like platform. Students can apply, create detailed profiles or individually vetted. It's safety first. Families can use it to find information about student caregivers without exchanging personal info. Students can see opportunities to help people in their community. And best of all, we run it for free. Families that book pay to students directly. So the students are earning 100% of what the family pays. Proud to say we launched it a little less than 3 years ago. We now have and this number is a little old, we have over 30,000 students on it across the country, including over 4,000 across our state at all of these wonderful universities. So it's a highly affordable option for many people. And basically the way it works for anyone that might be listening is if you need care help for your family, you can simply go to our site, CareYaya.org. You can book care online in less than 2 minutes. It's completely free to use. You schedule and book students to help you, and then you just pay them directly. The rates vary around 17 to 20 per hour, depending on length of session, and we're expanding it all over the state. Some of the feedback we get is people love students as companions, feels like family. It's like grandkids. That's kind of what we hear from a lot of people, which is really awesome. I private duty care is more affordable than traditional agency-based care. And I think that really affordability makes a big impact as your care needs grow, affordability increases. we're more affordable than any other private duty care registry, including care.com, because we charge no fees or markups. Students help with all kinds of things, including basic companionship, help around the house, grooming, meals, etc. Interestingly, we're finding a lot of students are even wanting to help with weekend care, overnight care, no surcharges. Students really love those opportunities, and we realize it's a big need for many families. And I think, what we found, we're backed by the AARP and the American Heart Association. We found through a lot of their research, about 60% of people who need help at home just need basic companion care. They don't need a nurse aide. So for all the non-clinical needs, this suits the need very well. I also think it's an awesome opportunity to bring a lot of younger people into the care workforce. Currently, most of our care workforce is not engaging the youth. Less than 10% of the care workforce is under 25 years old. So that really helps. And here you can.
CareYaya is affordable for Raymond. It allows us to have someone in with him while I'm away at work.
Things can build up, so I love to be able to come and help her out and give her a little break, help relieve some of that stress.
She listens to his stories and they go through photo albums, and it just gives me a great relief that he's not calling every few minutes at me at the office.
And anything that relieves the pressure off of Paul, I'm happy about.
So, those are like just kind of the experiences the families are having, as well as like really, the person receiving the care and the family member. I also think it's a great opportunity to bring men into the workforce. 90% of the home care workforce currently is women, but, I think men are equally capable in these roles and should be encouraged to address workforce shortages. And we find the younger generation is a lot more open-minded. So we're having awesome young gentlemen help out.
How you doing, Joe? Good to see you, buddy. Good to see you too.
We love it when Josh comes, because we know he's a medical student, yes, but he has skills. He has many skills, and that older people need.
And my goal is just to help them live their regular lives at the full capacity, and I do all kinds of things. I help out with the housework, I help out with the yard work, I help them get to and from their appointments, getting in and out of cars safely, getting up and down the stairs safely, all that kind of stuff, just so that they can live their normal everyday lives without having to worry about falls and stuff like that.
We stumble, he's right there grabbing the elbow.
Working with CareYaya is very easy.
And having Josh from the medical field with the knowledge of that, it makes it feel more comfortable.
I think this work is great because it just teaches me the empathy required to be a good physician one day. It teaches me the people skills that I'm going to need, talking to all kinds of different types of patients of different ages. So it's a really well-rounded experience that will.
So it's like really awesome to see kind of both families are having a good experience and the students are getting a lot out of it too. So, our impact so far is, we've single-handedly expanded the workforce by adding over 4,000 students in our state. We think at scale we can get tens of thousands. So we can really single-handedly make a huge impact on the workforce shortages. And
one of the aspects of my work with CareYaya that I treasure the most is that I've been asked by several families and patients to come back, noting their appreciation for the compassionate care that I provide. One of my favorite caregiving moments that I've had thus far happened to me last Friday. I was caring for an elderly woman whom I regularly see, and she told me that she wanted to try exercising on the stationary bike, so I assisted her to it. She made it to 85 pedal pushes and was satisfied with that number, but I encouraged her to make it to 100. The whole time she was counting from 85 to 100, I was cheering her on and hyping her up, and when she made it to 100, we cheered and laughed, and I gave her a hug. It was a really special and sentimental moment. Later that evening, when we were playing Scrabble, she sincerely thanked me for motivating her and believing in her, and that meant so much to me.
It's really awesome to hear, that was one of the wonderful students at UNC Chapel Hill who's going to medical school, and it's really awesome to hear kind of the reasons that I think the students are primarily driven by non-monetary incentives. They really want the experience. And as a result, the ratings and reliability are sky high, on-time percentages are through the roof. So it's really cool to kind of see the impact so far. So, reach out to us if you need any care help. This is the site, www.careYaya.org. And then you can also email me directly. And Daryl, if we're okay on time for a few minutes, I can also talk about our other initiative, which is to help people deal with health insurance. But yeah, I'll check in with you. How are you doing?
Yes.
Yes.
We have a little time.
Okay, great. Okay, so yeah,
Yes.
thanks everyone, and feel free to ask questions. And then I'll also jump into another huge problem that I see that I've personally dealt with, which is health insurance. You know, I absolutely am sick of these health insurance companies. They're denying claims left and right. It's happening to older adults through Medicare Advantage. It's also happening to everyone across society. And we really started a new initiative through CareYaya called Counterforce Health, and our goal is to make health insurance pay. This is the problem that I see. Health insurance claim denials are out of control, as we've seen with protests and unfortunate incident in December with the CEO of United Healthcare. This is me on the left when I was going through my wife's cancer care while she was in a coma and I was fighting health insurance denials. I mean, it was infuriating. And, you know, it's $1 trillion problem across society, given how many claims are being denied. And 99% of patients are not appealing because they don't know their rights. And if you kind of go through it, it's because 25% of them don't have time to appeal. 40% of them don't know who to contact. 70% of them didn't even know they had the right to appeal. And then interestingly, the point we saw is that something like 50% of submitted appeals are actually successful and you can get the claim paid. So, you know, we thought, okay, the problem is people don't know how to do it. So we built an AI that we're giving completely for free to people because it didn't take us that much work to build, and we got it grant funded through Johns Hopkins. And it was basically people can go to the site, upload their coverage policy and the denial letter, and within 2 minutes, it'll write a very detailed and well-crafted appeal letter with citations for you, as if your brother was a doctor and spending 10 hours writing it. We can then submit it with clinician support and doctors reviewing it, and then insurance company is much more likely to pay it out. So we're helping both patients and providers across North Carolina spend, you know, only a few minutes instead of hours and really save thousands of dollars. Medical bills are a leading cause of personal bankruptcy. We have thousands of people using it across healthcare systems, you know, disability rights groups, et cetera, and has been featured in a lot of major publications. And here's how it works. So people go to counterforcehealth.org and, you know, just kind of like click draft and appeal. You can drag and drop your coverage policy document, as well as you know, the denial letter that you got from the insurance company, upload it into the site. And then literally, this is like real time in terms of how fast it's working. It reads through the doc, understands the context, and then pumps out, oh, sorry, the video paused, pumps out a letter. Man, sorry, I lost my video, unfortunately. Sorry about that. Okay, here we go. Yeah, and then it pumps out a letter, and it basically reviews the policy, cross-references it with the database, and then goes and finds medical citations of why your claim should be covered, and then fully writes and proofreads and spits out an appeal letter. This whole process would take like less than like 2 or 3 minutes. And then here's like a detailed appeal letter of like, okay, you know, Blue Cross denied this, and this was the reason, and the billing code was wrong, and then they also said it was not medically necessary. Okay, here's all the reasons why. And it generated that letter. And then you can just click download and then submit that letter to the insurance company. So we're seeing like over a 75% win rate on this, which is just really awesome to see. So happy to help as many people as possible. And then this is the site where people can use the tool, counterforcehealth.org. So I'll pause there. I realize that was a lot of information, but you can contact me at either that or my main email, neil@careYaya.org, or visit us at our site. And yeah, I would love to help you. And then we'll also send around a copy of these slides for later. But yeah, happy to open up to Q&A.
Yes. Thank you, Neil. I don't see any questions in there, but I have one. Is there a minimum number of hours that a student can be hired for?
Sure. I think the students are happy to help with any kind of shift. I think because our platform is running nationally and we're like a very small group of people running it, we're typically kind of guiding people to do like 15 to 20 hours on a weekly basis. But they can break it up into whatever chunks they want. If it's like 2 or 3 hours at a time, or really the best is like the students, I think, want longer shifts, like 6 or 8 hours, because most of them are doing it like during days when they don't have classes. So I'd say kind of like open to all, but the best use case might be if you have 15 to 20 or more ongoing need, and 6+ hour shifts, I think you're much more likely to fill. Like we don't make the students do anything, so it just kind of goes on our site, and then the students have to choose which ones they want to do, and they seem to be opting for kind of like the longer ones.
Okay, great. Thank you. And I like the way that you're using technology to provide these kinds of services to people so they're easy to access and easy to find, you know, once they know they're out there. So we will share this information. I'm looking at the Q&A now. It looks like we've got a couple more questions. Are students available in all counties?
Great question. We're available in most, but I'd say if we are not available in your county and there's a decent sized university nearby, reach out to us at, you can go to our main site, or you can email our team at support@careYaya.org, and we can help. Right now, the most availability is around the schools that we have the best relationships with. So anywhere near UNC Chapel Hill, Duke University, NC State, Meredith College, A&T, NC Central, that's kind of like the core. Then we have expanded to ECU, UNC Greensboro. I'm trying to think where else. Appalachian State, Western Carolina, UNC Charlotte. So there's definitely a bunch of schools, but probably the maximum availability is, and the students are happy to drive too, by the way. So they'll drive, like UNC Chapel Hill students will drive to Mebane and places like that might be like 40 minutes away. So I'd say most of it is within a 30-minute radius of like the Raleigh-Durham area or the Charlotte area is where the greatest number of students are. But if people reach out to us, like for example, at East Carolina, we have availability. We had like over like 300 students, but then we didn't have the word out to the family. So maybe like 1 or 2 people were booking. So, we kind of paused there. But if there was enough of a need in a market that's within a 30 to 45-minute drive of a big university, yeah, we can serve that. So definitely.
Okay, great.
Yeah.
Great. That's good to know. It looks like you're in all parts of the state. May not be in every county, but all parts of the state already.
Yeah, pretty much all parts of the state. And there's enough universities there that and people are willing to drive, So if it's like a 6-hour session or 8-hour session, students will drive. Sometimes I've seen students drive over 45 minutes, sometimes even up to an hour to help someone. So yeah.
Right. Oh, that's awesome. What about in South Carolina is the next question.
Yeah, it's available in South Carolina too. Yeah, we're at University of South Carolina, College of Charleston, a couple of other places. I don't remember offhand, but yeah, we are across South Carolina too. It's actually nationwide now. So if anyone on the call is taking care of someone, like it went nationwide over the last year. So we're in Georgia, we're in Florida, Texas, California, New York, Massachusetts, Michigan, a bunch of areas. And we just got backed by American Heart Association a couple months ago, and they gave us some funding to like hire out a bigger team and take it fully nationwide into all 50 states. So that's going to be happening over the next few months. But yeah, we are in a lot of places now. And it's kind of crazy how much impact you can make with like a very small team. We're only like 6 full-time people running it off our computers in like a small office. So it's really cool.
Wow.
Yeah.
Well, wow. There are quite a few questions. What about taxes and liability?
So liability. So basically the way it works is very similar to care.com in terms of use the site as like a matching platform or registry. And then ultimately it's a private transaction between like you and the caregiver. We have an umbrella liability coverage that protects people just in case, in case something happens between the student and the family. But really the families kind of like are taking some of that liability risk themselves because we're not charging anything for it. And I think some of the care agencies upcharge so that then they can offset insurance. And then the agencies typically hire the person directly and then you hire them. So it's like an employee. In this case, like we're just a matching site online. So you are taking a bit of your own risk. The way we mitigate that risk is we develop relationships with the universities. So CareYaya doesn't just operate anywhere. No one off the street can apply. It has to be a student full-time enrolled at one of the universities we partner with. Then we verify enrollment. We do background checks on them, and we do video-based interviews of them. So once we go through all that screening process of all the people that apply, only about 20% of the people get onto the site. And then that's upfront vetting. And then ongoing vetting is that every student is rated in every family, that gets the care. They rate them on a scale of 1 to 5. And then the student rates the family too. And if we see anyone getting 4 stars or less more than twice, we reach out to see what's going on. And if we don't get an explanation, we cut them from the platform. So as a result of that, the ratings are kind of sky high. It's like over 4.7, 4.8 stars. And then on taxes, also, that's kind of up to you in terms of we run it for free. So it's like so low cost in the sense of we don't even process the payment because we couldn't figure out ways to get out of even credit card fees and things like that. So we leave that up to the family to pay the student directly. So it's cheaper for everyone, where like even if we weren't taking a fee, if we had a credit card payment thing that would cost 3.5% fee. So we're like, okay, Venmo person to person is free. Cash obviously has no fees, and then check also has no fees. So families pay the student directly. So you are responsible for keeping track of kind of like how much you're paying individual people. I'm not a tax expert, so you kind of want to talk to an advisor. But my understanding is that if you're below a $2,800 threshold of paying one individual, then you're not responsible for doing like a 1099 and kind of like doing the reporting. And because this is a bunch of full-time students, the most likely use case, let's say if somebody's like in Raleigh, Durham and booking 20 hours a week, it's that probably 3 or 4 different students are going to take turns during that week. Someone's going to help you on Monday, somebody else going to help you on Wednesday, somebody else going to help you on Friday, and then maybe the student repeats. So you have kind of almost a team of people. So most people, I'd say like 99% of people using the site are falling well below that kind of like tax reporting threshold where they have to generate a 1099 on someone. But again, I'm not a tax expert, so it'd be up to you. But I'd say overall, what I find is that because this is kind of like a do-it-yourself product, it is like orders of magnitude cheaper than any other care option out there. I believe in like Raleigh, Durham, a traditional home care agency is $35 an hour. CareYaya is 17 to 20. So it's like literally half the cost. And then for people that are getting like weekend care, a lot of people are getting evening care, overnight care. I believe that care agencies don't even want that. So they're charging sometimes $42 or $45 an hour. So it's like 17 to 20. So it's like way cheaper, which then hopefully offsets some of these costs that, okay, the family might have to do a little bit more work on their own.
I do have a question from one person said, is there help for funding with caregivers? And maybe Lindsay, you might want to chime into this one as well.
Yeah, maybe that's a great question for Lindsay. I don't know a lot about that side.
So for funding for caregivers, the most common you'll see is respite vouchers. So these are very low increments. So Project Care, the program I mentioned, is $500. People theoretically could get it up to 3 times a year. Most people, because so many people are requesting it, it's one max. But in terms of getting paid, the CAPTA program, it is a monthly amount paid to caregivers. But I think that's the only pathway that I am aware of where caregivers can get paid. So certainly look into that.
Okay, and I'm not sure if they were, where the caregiver can get paid. Yeah. I, to expand that a little bit, maybe they're talking about, is there some funding to help with caregiving other than the ones that you mentioned? Did I miss something? I'm not sure.
No, really, that's it. So most of the
Okay.
caregiving is borne by the people that are doing the caregiving, which is really unfortunate.
Okay. And then there was one other question that I was going to ask. Oh, someone asked about the minimum age for students. Do you have a minimum age?
18.
18.
Yeah.
Okay.
So
And are students able to select assigned based on geographic location and close proximity?
yes, yeah, they see. So we don't make anyone do anything. So it's like they're not like employees, where we tell them what to do. It's they see the opportunities and then they kind of get like a map, without revealing the person's exact address. They will see a map with a pinpoint. So if you're like at, let's say, like Josh, the young man that was in the video, he's at North Carolina State University in Raleigh. So, when Kathleen and Joe, the family that he's helping, they were booking, they were in like East Raleigh. So he can see that, hey, they need help with Joe. And okay, from where I am in my dorm, it's about a 15-minute drive. So he can see that. And then if he accepts, then it shows, okay, this is the address you got to go to on Thursday at noon, and do that. So yeah, they can see. So most of them I'd say most of the students are happy to drive up to half an hour. And then if they're in a more rural area sometimes, or they just really want the care opportunity, sometimes they'll drive like 45 minutes to an hour. But yeah, they get to see it.
Okay. Wow, that's great. So the last two, someone asked if there's CareYaya in Wake Forest, and the other
Yes.
question is in Asheville. Is it in Asheville?
Asheville, not quite. But if somebody wants it, I can try. The challenge with Asheville is that the only big school near there is Appalachian State, and it's like a little bit of a drive. But if there's a real need, we can try. UNC Asheville is just like there's not enough people, so we couldn't figure out a way to get enough students. But again, I'm kind of like building a grassroots. So if somebody has like contacts at the university, I'd be happy to reach out and try to figure it out. But when I tried myself, I couldn't figure out how to get enough students on it at UNCA. And then all the App State students were like, it's a little bit far. So, but happy to try. And then Wake Forest, but yes to both in terms of if it's Wake Forest, the town that's like outside of Raleigh, yes, there's care going on there. The NC State students are happy to drive there. And then if it's Wake Forest, like the university in Winston, yes, there's a ton of Wake Forest University students, and we're serving a lot of care in Winston. Also Winston-Salem State, as well as like UNC Greensboro and High Point students are doing it. So yeah, there's a lot of care going on there.
Okay, great. Lindsay, do you have any final comments?
I do not, other than just please feel free to reach out to either us at the association or our helpline if you have any questions. And you may not today when you're caregiving. It's often a long journey, so you may have something that pops up later on. But whether it's us or another organization, there are people there to help you and understand what you're going through. So I know sometimes it's hard to reach out, especially when you're stressed, but don't be afraid to do so.
Awesome. Neil?
Right. Yeah, nothing from my end. I think, thanks for the opportunity and reach out anytime. I put our email addresses on there. I'll put my email also, but you can check us out at, oh yeah, thank you. You can check us out at CareYaya.org if you need help with care. And then if you are fighting any kind of health insurance claim denials, love to help you. That's counterforcehealth.org. We're actually talking with North Carolina Insurance Commissioner because they're realizing how big of a problem it is. So we're trying to do a grassroots effort on that too, to kind of start regulating some of the insurance companies more. So yeah, happy to help on either one. But thanks for the opportunity. And there's my email address also if you want to reach out to me personally.
I'm just gonna take one more question. Does a student have to be in medical studies, in a
Yes.
medical studies program?
Yes, they have to be aspiring to medical study because we didn't want people just doing it for the money, and that's fine. I think that some people can do it for the money. We just thought that and they don't have to be currently they have to be studying something related to medical. So, Josh was studying biology at North Carolina State and wants to go into medical school. So, Stephanie was studying biology and she wants to go to medical school. And then McKenna was actually in nursing school. So they have to be in something that's a preclinical career. So they don't have to be necessarily in graduate school. They could be undergrad, but we only want people who want to kind of go into a healthcare pathway because otherwise we were worried that people might just do it for the money. And it is sensitive care. And we just want to build a good, kind of good system where money wasn't the primary motivating factor and something else like getting experience towards a future field. Many of them are, I personally write a lot of letters of recommendation for people. They ask us for downloads of the care hours they've done, and they, write they lead their medical school or nurse practitioner graduate application with that, or many are going to physical therapy, occupational therapy. So we really want the students to do it as a career pathway, not just as a way to make money.
Right. And students want to practice. I came out of academia and that was very important. So thank you both, Lindsay and Neil. We really appreciate you being with us today to share this important information. And many of our members have certainly asked about caregiving resources. So we especially appreciate you. And like my brother would say, this is good stuff. So now we have finished the questions, but before we leave, I want you to know that if you have additional questions, just reach out to me at Daryl at rgea.info. And by the way, we just changed our email address to rgea.info. And I will send you I will send your questions to the appropriate person for a response. Don't forget to complete the survey we'll be sending you later this week. And again, it's quick and easy to complete, and we need your responses back by Monday. Before we leave, note the Lunch and Learn webinar scheduled for April 23rd at 12:30 to 1:30. It's entitled Essential Tips to Stay Prepared for Weather and Emergencies. Please plan to attend this very important webinar as we are approaching seasons of weather and other events. This webinar is brought to you to help each of us better prepare for being safer during these times. So thanks again for joining us. And as always, the association stands ready to assist you in your retirement. Happy Wednesday and stay safe. Take care, everyone.